Morning, ladies and gentlemen. Dorothy here from the CCMA. You're very welcome to our Friday Ask the Expert series. I'm delighted to be joined this morning by Jennifer McCartney from PayPal. And obviously, as always, Niamh with us too to help and support us in the technology. Hugely important topic this morning, and we're delighted that we have this expert with us. And we're talking about mental health in the workplace. And specifically, we were linking it to World Mental Health Day, which was last Saturday, as many of you will know. And Jennifer is a qualified psychologist. So she's going to talk to us about the need to talk about mental health in the workplace. And she's going to give us an overview presentation on different aspects of it and how to approach it with your team members, teammates. But as always, we want this to be as interactive a session as possible. And there's a huge interest in this topic this morning. So please put up any questions that you have, make any comments or observations that you have as we go along. Jen is going to talk for about 15-20 minutes, and we may take some of the questions as we go along, or we may wait till the end. We just see what the questions are and where they sit in. As always, we're recording this webinar, and we will have a copy of Jen's presentation to share with everybody afterwards. But really appreciate Jen's time. She's been a great support to us in the CCMA the last couple of months. We've been doing a lot of work on diversity and inclusion that we'll come back to you on in the coming weeks and months, but Jen has been the spearheading that for us. So we really appreciate her giving her time this morning to talk about this topic. So Jen, if it's okay with you, I'm going to hand over, give the screen to you and the presentation to you. And as I say, come back with any questions at the end. So thanks a lot, and hand over to you, Jen. Thank you.
Thanks very much, Dorothy. And I'm just going to start sharing my screen. And so, as Dorothy had mentioned, my name is Jennifer McCartney, and I currently work for PayPal, where I lead our leadership excellence team there. But coming from a background of psychology as well, it can be such a stigma about talking about mental health in the workplace, and it's such a really critical topic. So really delighted that I was invited by CCMA today to talk to you about this. So some of the topics that I'm going to touch on today is just really what is mental health, and then looking at earlier intervention, prevention being better than cure, sometimes spotting those signs of stress or of mental ill health early can really be helpful. And then what are some of the things that you can do to support your employees in both staying well and staying in work? But often a number of pitfalls can occur in the space of mental health when it comes to broaching the subject with somebody or responding to their disclosure. So I'm going to spend some time talking about that, and then share with you some resources that you can use to explore further in the future. So I just wanted to start by talking about the spectrum of mental health. So mental health, in the same way as physical health, it can fluctuate on a spectrum from good to poor. You know, mental health issues can affect all of us, regardless of our age, our personality, our background. They can appear as a result of experiences in both our personal and our working lives, or they can just happen. About 1 in 4 people will experience a mental health event or a mental health problem in any given year. And employees can be affected either directly or indirectly as well. If maybe their partners, their dependents, or other family members have mental health problems, which in turn can impact their own health. And then people can be affected by their friends and fellow employees' experiences as well. So mental health problems can affect the way we think, feel, or behave. And in some cases, this can seriously limit somebody's ability to cope with day-to-day life, which in turn then impacts their relationships, their work, their quality of life overall. But many people can effectively manage their mental health problems alongside the demands of a job and daily life, sometimes with treatment and support, whereas others may experience symptoms of mental health or ill mental health, but never actually be diagnosed with a condition. But the most important thing to remember is that everybody's experience of mental health is different. 2 people with the same condition may have entirely different symptoms and coping mechanisms. And there can be a common assumption that a mental health problem is something caused by home issues. So some employers maybe feel that it's not appropriate or maybe not even their responsibility to intervene and support their teams. But in fact, most mental health problems are usually a combination of issues that somebody is facing at work and outside of work. And one study found that 65% of people who do report poor mental health said that it was a combination of work factors. 20% of people saying that their poor mental health was down purely to non-work issues, and 15% relating it to work alone. So between that 65 and 15, that's almost 80%, is having or some variable is coming from work. So it's really impossible to disentangle the impact of various factors on mental health. So it really is an employer's interest to actively support their teams with mental health problems, regardless of the original cause or the trigger. It has a wider knock-on effect for the employer that can be significant, as positive employee engagement really means that staff feel more valued and are more likely to kind of go that extra mile for the organization. Mental health can take many forms. Just some of them are listed here. I'm not going to go through the list. I know that you're all very capable of reading, but one of the things that I wanted to say is that the terms that we use to diagnose mental ill health, they sometimes are words that we use every day, things like depression or anxiety, and that can make them easier to understand. But their familiarity can also mean that we underestimate how severe or how incapacitating some of those conditions can be. So we need to be very mindful of that. So, for example, we should be mindful of the difference of somebody who's maybe been clinically diagnosed with depression versus the casual use of the term just to be used to describe somebody who's maybe feeling a bit down. Listed here are some of the commonly diagnosed forms of mental health problems, but it's not an exhaustive list. And as people react and respond differently, and men and women can respond differently too. So it's important not to dismiss other symptoms. And just speaking about gender, men are less likely to have their problems identified by professionals and are often less likely to seek help or to talk to their friends or family members. So they may not have a diagnosis even if they are experiencing problems. So when you're supporting your team, it's important not to label people with a diagnosis and instead talk to them about how it's impacting their work, really. Some of the early intervention triggers, as I said earlier, everybody has mental health, and like physical health, it fluctuates along that spectrum. And as I talked about, work can have a huge impact. It can promote well-being or it can trigger problems, no matter how well people are managed. Some people, as I said, 1 in 4 every year, some people will experience a mental health workplace in the problem in the workplace, and particularly within COVID and this current climate will exacerbate that issue as well. Spotting some of those signs of ill mental health at an early stage can help you to address the issues before it escalates into a crisis or a sickness absence. And as a result, the causes of mental health problems are often very complex, but research has shown that about 70% of employees' mental health problems are either caused by work or a combination of work and home. So a management approach that only looks at mental ill health as a medical problem isn't likely to be one that is overly successful. And so a key part really is spotting those signs early, so that you can minimize kind of some of those escalations. Most managers know their employees pretty well. They regularly are holding one-to-ones. And so as a result, they're usually well placed to spot early signs of mental ill health. And this list is by no means an exhaustive list. And Often the key, and this is really important, is a change in typical behavior. So when you've known somebody for a while and you see that shift in the behavior, that is often the key indication. The symptoms will vary as each person's experience with mental ill health, it varies. But these are just some of the potential indicators to look out for. And as I was saying, it's not an exhaustive list. And the other thing I'd call out here is that just because one or more of these signs are observed, it doesn't automatically mean that the employee has a mental health problem. It could be another health issue or something else entirely. So it's important to take care not to make assumptions or to listen to third-party gossip, really, and to talk to people more directly about it. So stress can be a significant variable and contributor to mental health and mental ill health. And this is just one definition of stress, but of course, a certain level of stress is good in a business environment because it can help people to motivate themselves and boost their energy and their productivity level. But when that pressure exceeds their ability to cope, and particularly if there is no respite from it, it can become a negative force rather than a positive force. So it becomes an unmanageable stress. And people respond in the same way to emotional stress as they do if it was a physical threat. So you get, muscles becoming more tense, heartbeat and breathing can quicken, your body can go into that fight and flight mode. And there's various hormones like adrenaline and so on that are triggered. And unmanageable stress can have, physical, psychological, and behavioral symptoms, which if they're not addressed can be a contributing factor leading to longer term mental health problems. So whereas stress in itself isn't a medical condition, research has shown that prolonged exposure to unmanageable stress is linked to psychological conditions like anxiety and depression, as well as being a contributing factor to physical effects like heart disease, back pain, headaches, and so on. And some studies have shown that people in high stress jobs have a greater likelihood of developing those conditions. So prevention really is better than cure. And often it's about common sense. Leaders who regularly ask their teams how they are and take an interest in their lives outside of work are more likely to build up that trust and be able to kind of prevent and manage stress at work. But at the same time, on the other hand, managers who assume their teams are okay, who maybe are indecisive and inconsistent, or maybe mainly give negative feedback or create unrealistic deadlines, might be more likely to exacerbate stress. So a common sense approach is really important. And that's kind of the main piece there about the common sense piece. But I do have some do's and don'ts here in regards broaching the subject. So sometimes somebody will disclose an issue to you, or other times you'll observe it and think something that might be going on. But shying away from the subject really can perpetuate that sense of fear or stigma and increase somebody's feeling of anxiety. And employees might not feel so confident about speaking up. But if it is disclosed or suspected, it can be critical to have a early intervention conversation. And as I was saying, basic good people management and the use of empathy and common sense really lies at the heart of effective management of mental health in the workplace, particularly when managers are seen as approachable and open to listening when their people ask for help. And you should also consider how mindful or be mindful of your work environment and how conducive your culture is to disclosure. But these are some general best practices and kind of common pitfalls in regards preparing to have a conversation. Now, I'm not going to go through all of them, You know, some of them are general best practices about private time and, you know, avoiding interruptions and really focusing on the person. What I would say is that questions, and I'll share some suggested ones in a moment, but they should be simple, open, and non-judgmental to really give that person the opportunity to explain in their own words. You know, if there's specific grounds for concern, such as impaired performance, it's important to address that at an early stage. But in all cases, people should be treated in the same way as somebody with physical health problems. It's a good starting point. A good starting point can really just be asking, you know, how they are. There's a couple of things I want to point out in the don'ts list, though, that are really important, and I've put them in bold here in this slide. The first one is not to diagnose. Really focusing on observed or reported behaviours is important. You know, don't speculate about whether a person maybe has ADHD or OCD or is bipolar or any other condition, even in a joking way. And that can be hard to do in an environment where you're very task focused or focused on solving problems. But that could potentially open you up to legal consequences, as well as increasing that stigma and fear about talking about mental health in the workplace. So instead, should be about expressing concerns maybe about lateness or absenteeism, performance or productivity or productive issues, their engagement in the workplace, or any other observable behaviours that you've seen, and really focusing on performance issues. But sticking to the facts while conveying empathy is really important. Probably more important, though, is the last one that's listed there, which is around not promising more than you can provide, particularly when you know somebody quite well. You know, our tendency is to tell a person who's hurting, particularly when we have a relationship, you know, that we're available at any time, you know, that they can trust us, we consider them a part of our family and so on, which sounds great on paper, but there's a few problems with that approach. You could set the person up to be disappointed when you can't offer everything that they need. You could take on more than you bargained for and end up feeling overwhelmed. And, you know, it is a workplace and not a family environment. So while you might care a great deal about the person, you want to be mindful about not crossing boundaries or giving the perception that an individual is getting differential treatment, which could cause overall problems within the work environment. I'm not going to go through all of these questions. Again, you can have a look at them afterwards, but when somebody does disclose something, these can be some great questions to ask and some great questions to avoid as well. And, you know, you should really encourage as well your employees to see their GPs as a first step, you know, and ensure and make sure that both you and they are aware of any support that's available from your organization, like employee assistance helplines and so on. But generally speaking, if you're responding to disclosure, it can be viewed as fear sometimes by people, but it doesn't have to be awkward or taxing. You know, if you remember that the aim of it is to create an open and honest dialogue, that's going to lead to a system of support and understanding between you and your employee. And as I was saying, generally a common sense approach is good, but these 5 guidelines I think are quite critical. So the first one would be just to avoid making assumptions. It can be very difficult for people to disclose information about their mental health. So keeping an open mind makes it easier and helps give them the space to talk about it. And avoid trying to guess what symptoms an employee might have and how they might affect their ability to do their job. Remember that many people can manage their condition and still perform their role to a high standard. The second one is about confidentiality. You know, people can be anxious about disclosing things, so you want to assume responsibility for some confidentiality as much as you can. Maybe there's strict policies about who's aware of disclosures in the surrounding teams or in your own management. And as a rule, that should involve as few people as possible. It's not something you necessarily want to announce to the whole team, and as much as possible, reassuring people that what they've disclosed won't be leaked to their colleagues as well. Encouraging people to talk. Sometimes you just need that person to listen. So having that open dialogue, and again, remembering that everybody's experience of mental ill health is different. So even if you dealt with somebody who's had a similar issue in the past, it could show up very differently in somebody else. And you really want to focus on exploring how the condition manifests itself from a work perspective, you know, what the implications are and the support they need, which leads into how can you respond flexibly. You know, mental health can affect different people at different times and in different ways. And it's worth looking at, you know, what are some adjustments and so on that maybe could be made, be it in maybe more flexible working hours, or sometimes reducing their workload or getting additional support in their workload. But be really aware of the steps to take if you're concerned that somebody might have suicidal feelings or something more extreme, and ensure you're guiding them towards their GP or the Samaritans or other support services. And really critically is, if you're still unsure, you know, that maybe the person lacks that insight or that the issue is particularly complex, don't be afraid to seek advice yourself from those supports like the employee assistant helplines that are available to you, as well as some of your, you know, your teams. If workplace relationships are strained, maybe mediation could help. That could be a significant contributor to stress and so on. And as I said, you know, maybe your organization might have occupational health consultants that are in place that you can use to support things. But they might need increased supervision, you know, mediation, as I was saying, maybe a phased return to work with reduced hours leading up to them coming back, temporary allocation of some of their tasks, and normally I'd say working from home if needed in a short-term basis, but I know that many of us are doing that at the moment. I'm going to stop and open for questions. When Dorothy shares this at the end, I have put together some useful resources that you can use to kind of explore the topic further. But I've also included some really great resources from the AWARE organization. And this first PDF in particular is the frequently asked questions that AWARE are asked. So AWARE is an organization within Ireland primarily to support people with depression, anxiety, unmanageable stress and other issues. And there's some really great guidelines and practices in there. There's also some great information about anxiety and depression in general. And if you yourself are supporting a loved one or somebody else who's very close to you, there's some really good hints and tips in there as well. But really asking and talking to the person and listening to understand rather than to fix the issue, I think are some of the really critical ones. So I'm just going to stop my screen now. And Dorothy, I'm not sure if you've gotten any questions there that I can help address.
Yeah, absolutely.
That too quickly.
Yeah, I think to kick off, one of the questions I had was, you know, at what stage do you involve HR? And I know you touched on it there towards the end, Jen, but I presume you have to get the person's permission, or how does that whole side of things work, that you sort of formally advise the people that need to be advised?
So Dorothy, there's no black and white answer to that question, unfortunately. I think the important thing is to look at their performance within the role and how is this mental health issue impacting their overall performance. Usually at the end of the day, we're trying to achieve something, and particularly if it becomes a long-term issue and the individual can no longer perform the tasks required of their role, it's going to end up being a performance management conversation that includes HR to begin with. If somebody discloses a mental health issue, you can always ask them, are they comfortable with you discussing it with HR, particularly if they have specific requests in relation to maybe reducing work hours, you know, and phasing back up, or looking for specific out of the ordinary requests that you wouldn't deem normal for the rest of your team. Usually those are the cases to involve HR. But again, if there's EAP services or occupational therapists available, there could be value in involving them first. But look at the observable behaviors and how it's impacting their work. If it's a short-term issue and the person can still meet the requirements of their role, it might not be necessary. If not, then it can become necessary, or when they're looking for changes in their current work structure, if that makes sense. Does that help?
Absolutely. Yeah, no, perfect. And Jen, another question, in the roller coaster that is in COVID, and I actually think well done, I think we were nearly 10 minutes in before you even mentioned it, which is great, not to have to be constantly hearing about it, which is good. But in that roller coaster of all of us having good days and bad days, you know, any tips on what people should do? You know, if you know somebody's having a bad day, do you do the whole let's have a cup of coffee and talk about other things not related to work? Do you bring the team together? Like, any insights on what companies should be thinking about?
Yeah, so, you know, one of the things I mentioned, Dorothy, when it comes to mental health overall, you're looking for a pattern in a change in behavior, right? So before you maybe decide to broach a conversation about mental ill health and so on, but we all have bad days, you know, so checking in with somebody and saying, you know, do you want to have a chat, or do you want to have a cup of coffee, can be good, but make it an offer, because maybe you're actually taking out more time from their work day, which in turn will lead to additional stress. And particularly if you're their line manager, think about what's the relationship I have with this person. For some people, when their leader comes along and says, hi, do you want to have a cup of coffee? That can actually be scarier, you know, and they think it's going to be related to their performance. So it can depend on you need to judge that situation, depends on your own relationship. But if you're seeing that maybe they're acting out with the rest of the team, and then maybe a small intervention is needed, then maybe just putting in a 15-30 minute cup of coffee informal chat and just say, you know, I thought you seemed a little off today. I just wanted to make sure that you're okay. The other thing I would share, though, is if you're looking for people to share with you, sometimes if you give a bit, you'll get more back, right? So if you share with them, you know, I've been finding it a challenge, and, you know, particularly at this time of day, I'm used to doing this. I notice at this stage of the week, I'm finding it's impacting me. If you share about how things are impacting you first, you're more likely to get something back from the person you're speaking with.
Perfect. And my last question then is, if you're a member of a team and you sense that another team member, so you're not their boss, as it were, or their manager, how do you go about that? So if you're a member of a team and you think, you know, oh, Dorothy, you know, is struggling a little bit, you know, is there a different way of handling that, or is it similar?
And again, it depends on your relationship with that person, right? Yeah. So if you have a really good, strong relationship, maybe you start by doing those same things. You know, I noticed you're a bit off today, or I've noticed you're a bit off recently. How are you? And so on. But if you suspect that something more significant is going on, and that maybe their leader, your shared leader, isn't aware of, it may be worth just mentioning it to them, but having some specific examples so that it isn't deemed as workplace gossip. All that will do is it will enable the leader to keep an eye on the person and to watch for it themselves. So to kind of increase their own awareness, look for that shift in behaviors, and then intervene when they feel necessary. But in extreme cases, if somebody does tell you that they're feeling suicidal, you know, then that to me would almost break all rules. If it was something that extreme, then that would be the line for me, you know, straight away then saying we need to check in on this person, because if something did happen and you didn't address it, you know, that could lead to impacting your own mental health in the future.
Of course. Yeah.
Empathy
Brilliant.
is key.
Perfect. We've reached 11:30. I think that was superb. I just think great insights and great additional supports and information there for everybody that's on the webinar this morning. So thank you so much. You're so good for giving your time and for the links to all of that information. So we'll put that up this afternoon, the PDF with your presentation, and then the video, hopefully, Niamh, we'll get it up on Monday. So I really think this is one that, you know, everybody in the call should be sharing with their colleagues and teammates. And it's maybe something that if people watch individually as a team, it could be something they could have a discussion around that just would prompt the conversation, as it were.
Absolutely. And Dorothy, by all means, if anybody'd like to connect with me on LinkedIn or they've got specific questions, it's a topic I'm incredibly passionate about and could talk about for hours. Trying to do it in 30 minutes is challenging, but if anybody would like to ever talk about it further, they can always find me on LinkedIn. I'd be more than happy to chat to them.
Perfect. Or they can drop me an email and I'll introduce you. I know you're happy to do that as well. Just to let everybody know, we've been running a series of yoga, free online yoga classes the last 2 Thursdays. So that's to try and help support everybody and give them a little bit of a break. And they'll continue for the next 2 Thursdays, and they're at 12:30. So the details are there on the website if anybody's interested in taking part. I did the first one myself, and I'd never done yoga before. I thought it was great. So it was really enjoyable. So thanks, Jen. Thanks, Niamh, as always, and hope everybody has a lovely and safe and healthy weekend and gets out to have a few walks and enjoy the nice weather that we have today. So we'll see you all soon, and thanks as always, Jen. Really appreciate it.
Thank you so much.
Take care. Bye.
Bye. Bye-bye.